My name is Jerry Hesch. I'm a physical therapist at Hesch Institute in Aurora, Colorado. And I trade work with a physical therapist. And we did some upper cervical work today, among other things. And I want to document each time I encounter an oblique restriction of the Occipitoatlantal joint. And part of my screen of the Occipitoatlantal junction is to come on top of the mastoid, one side at a time, and I spring it in an open chain with my thumb to evaluate rotation. And then I come underneath the mastoid and I lift up to evaluate side bending. And I also evaluate lateral shear on each side. I also come down and evaluate rotation, side glide, and PA mobility of the atlas and then of the axis. What is interesting is that one would think that the combination of a rotational and opposite directional side bending restriction that would equal an oblique restriction. So if you stack those vectors, if you add those vectors up, it seems that that would equal an oblique restriction. But what's interesting is that on the right side, when I was springing the mastoid, she had mobility. When I came beneath the mastoid and I evaluated side bending, she had mobility. However, when I evaluated oblique mobility inferior to the right, so I was springing mastoid down to the right at a 45-degree angle, she was blocked. When we tested the left side, she was blocked. I see this on occasion. I've never seen it on the left side of the body. We know that developmental asymmetry in the spine is most prevalent at the L5-S1 junction, and the second most common location is the Occipitoatlantal junction. And the shape of those joints is as though I were carrying a heavy bowl. So my hands are at an angle inward and they're cupped, and that somewhat simulates that angle. So I describe the position of her occiput as though a bird flew from downwards on the left up above on the right, as though she turned her head to the right to look up and over her shoulder, and the occiput got stuck there. So the treatment that I utilize is to do traction isolating the OA junction. So the technique is important because most of the cervical joints are posterior to the pin of the ear, whereas the upper two joints are right below it. Then your contact needs to be pretty much on the temporal bones, and that will assure isolation of the upper cervical. So I do manual traction, and I hold that for about 30 seconds or so to take up all the slack. And then I do a scooping maneuver up to the left. Okay? I maintain the traction and I just do really subtle. This is a great exaggeration for the camera. You know, it's really a subtle, small movement that I utilized. And we treated her and we restored rotation. And I have not seen this oblique restriction described in the literature, and it's for that reason that I want to document cases when I encounter it. So I just thought I would close by asking her how she felt in response to that treatment. How did you feel with the evaluation, and how did you feel in response to the treatment?
The evaluation, I just felt the restrictions in the directions that you were talking about, especially the oblique, tilting my head. That's where I would feel that restriction. Also, side bending my head to the left. That's where I would feel all that restriction. I also, when I would turn my head to the right and look up, just like you were saying, gosh, it was interesting. Many times I would feel almost a pinching, maybe even in my hyoid area, something in here, something pinched or something moved, and it's done that for a long time. I don't know why or whatever, but it definitely feels freer now. I can side bend a lot better and tilt my head. And I just got a little tiny bit of tightness, not like it was.
Yeah.
Before
So
you started,
the concept of treating an oblique restriction of the OA joint when it's encountered, for you it does have utility.
Yeah.
Great.
Oh yeah.
Very good.
Absolutely.
Well, I hope this is informative. I had one client, he was 82 years old, and for 60 years he had a mild headache from this type of a restriction, and we treated him once. And I follow up with his son on an annual basis, and it's been more than 4 years, and
Wow.
he's doing fine. It was a one-time treatment.
Yeah. You know, the last time that I had some work done like this, Mulligan did it to me on C1. And
Oh, is that right?
He had rotated it, and I did a full rotation to the right, and that was the only other time that it ever freed up even a little bit was when he did that. It was a very forced right rotation onto that C1.
Yeah.
And I had lots of headaches at that time.
Is that right?
It was all the time temporal headaches, but I haven't had them since.
Oh, that. Wow.
But I
Excellent.
probably deal with the chronic low-grade headaches that I've just adapted to for forever.
Yeah.
So I'm feeling a lot of different stuff, a lot of better, I suppose, on a level of better, because my head doesn't hurt like it used to.
Yes.
So I'm getting better.
Nice. That's great. That's wonderful. So I hope this has been informative on the evaluation and treatment for an oblique restriction at the OA joint. Thanks so much.
Thank you.
So I'm going to